Okay, so how Gleason score is calculated? So look at the tumor under the microscope, or the pathologist identify the two most common patterns of cancer cell. So what happens actually that the pathologist usually look at the specimen under the microscope, and it identifies two most common patterns and give it a name. Okay, so each pattern is graded from 1 to 5. For example, 1 is the well differentiated and 5 is the poorly differentiated or worst. So they do that they give it numbers or names. For example, primary grade is the most common pattern, and secondary grade is the second most common pattern. So they combine these both pattern, primary grade plus secondary grade, to get the Gleason score. Okay, so what happens actually that, for example, okay, so what happens actually that we have, let's suppose, for example, the most common pattern grade let's suppose is grade 3. Okay, so the most means the dominant pattern is grade 3, so they take grade 3. And let's suppose the second most pattern, or the second most dominant is a grade 4. So they calculate like 3 plus 4 is equal to 7. So this is the total score Gleason. If only one pattern is present, for example, the only dominant pattern is let's suppose grade 4, so they double it. So 4 plus 4 is equal to 8. So what we get, that we get the Gleason score, and Gleason score is interpreted as less than 6 or equal to 6 is low grade overall grade, and 7 is intermediate, and 8 to 10 will be the high grade or aggressive prostate cancer. So what is actually that we usually select the most common pattern or the most common grade, which is the primary grade, and the second will be the second most dominant grade. So that's all about the Gleason score calculation.